Topic of today is etiopathogenesis of radicular cyst. What is the other name of radicular cyst? It is periapical cyst. Why it is a periapical cyst? Because it is found in the apex of the tooth. This is a periapical cyst. In this area, there is enlargement which is generally asymptomatic. It is named as periapical cyst because it is seen surrounding the apex of the tooth. Surrounding, it is seen around the surface of the apex. Now, we all know that it is an odontogenic cyst. Why it is odontogenic cyst? Because the origin is by stimulation of cell rests of molasses. Now, what is the third important point about periapical cyst? It is not developmental cyst. Examples of developmental odontogenic cyst are dentigerous cyst, OKC, lateral periodontal cyst, or gingival cysts. Then what is it? It is an inflammatory odontogenic cyst. Why inflammatory? Because it is generally preceded by periapical granuloma. Now, the other reason is there is inflammation of periodontal ligament cells, which in turn leads to stimulation of cell rests of molasses and formation of periapical granuloma. So, thus both the terms inflammatory type and odontogenic cyst, but basically it is an odontogenic cyst. Now, what is the fourth important point about radicular cyst? That it is most common odontogenic cyst and it is found mostly in anterior region of jaw. Now coming to today's topic is etiopathogenesis of radicular cyst. We have to remember three important points or three important phases. Phase number one, phase of initiation. Then phase of cyst formation, and third important phase is phase of cyst enlargement. So this is the picture which is showing these three phases. In phase number one, there is stimulation of cell rests of molasses because it has got already inflammation in the area. Number two, there is proliferation of these cells. These cells are continuously increasing in number. And then there is typical formation of a cyst which has got a cavity, which has got epithelial lining. And number three, which has got a capsule. This cavity contains different contents. They are mostly in form of liquid. So let us discuss these three features one by one. Firstly, there is phase of cyst formation, cyst initiation. In this phase, there is proliferation of cell rests of molasses. Number two, there is already inflammation in periapical area. Periapical area has already some inflammation in the form of periapical granuloma. Number three, so number two, there is already inflammation, already periapical granuloma. And number three, these cells, the cells start to proliferate. Which cells? The cells of cell rests of molasses. This is cyst initiation of the cyst. Phase number two, which is called as phase of cyst formation. Now, in this phase, the epithelial mass is continuously increasing in size. This is the formation of epithelial mass of cells which is surrounding the apex. So there is formation of number one, epithelial mass. Number two, it forms by division of cells. Number three, the cells of central area, they go far away from the source of nutrition. This phase, there is formation of epithelial mass. So this is this second phase of cyst formation. Then number three, is phase of cyst enlargement. This phase, the cells of central area, they degenerate. So there is degeneration of cells of central area. As a result, they become necrotic and they die. So there is formation of central area which is filled with fluid. There is formation of central area which is filled with fluid. Number three, this fluid contains high gamma globulin level. As a result, there is increased osmotic pressure, which further leads to increased absorption of fluid and hence enlargement of cavity. The cavity continuously grows in size. There is also formation of hyaluronic acid, and there are many products of cell breakdown. Now, what is the function of these two things? This, this hyaluronic acid and the products of cell breakdown lead to increased osmotic pressure. There is increased osmotic pressure and increased pressure on cyst wall. Increased pressure of There is increased osmotic pressure and there is increased osmotic pressure towards the outside area. As a result, there is resorption of bone, which further helps in enlargement of cyst, and thus formation of a typical cyst is surrounding the apex of the teeth, which has got cavity, which has got epithelial lining, and has got surrounding capsular area, and thus it is a true cyst. Thank you.